Let's start the topic from the documentation and reporting. What are the types of nursing records are there? When we see here, there are always different records we are using in the hospital setup. Among that, the commonly used records we are discussing here, the types of nursing records. The first one is admission nursing assessment. Admission nursing assessment, and second one is nursing care plan. These topics are very important in the second year medical surgical nursing when you are studying. So, nursing care plans, cardex, and patient information. Then, medications with the date of order. We call it as a medication card. A small card will be there. So, medication with the date of the order and time of administration, and daily treatment and procedure records. Then graphic records, flow charts. The flow charts and graphic records usually we are using in the vital signs monitoring. We can maintain like on the time of admission on the time of admission how much temperature is there or how much respiration is there, then and later on whether it is increased or it is declined, the flow chart way we will use or graphic records we will use. So like TPR and BP, which I mentioned, temperature, pulse, respiration and BP, fluid balance records, medication records, skin assessment records, and progress notes. Progress notes, even today, most of the hospitals are following this pattern. Like nurses' notes will be there. What are the things we have done in the morning shift or afternoon shift or in the evening shift? According to that, the next continuation nurse will follow what need to be done. That's like we call it as a progress notes. So commonly used notes as existing in present scenario is Cardex's nursing care plan, then flow charts, graphic charts, then fluid balance chart, medication chart, then skin assessment record and progress notes. These are the different kinds of nursing records we are using in the day-to-day practice. Then next we'll see very important points in this topic I would like to discuss is when you document anything when you document anything, what are the principles you have to follow when writing anything in the patient record? Because already I mentioned it can be used as a legal document also in case of any criminal offenses or in case of any claims. It is like a legal evidence and it is a communication in any cadre people or any kind of department should understand what you have documented even when you are absent. That means we have to follow some principles in documentation or some elements in effective documentation process. So the first one is use of common vocabulary. Use of common vocabulary. The word itself is saying what you know or what a social media using like some short forms. Those kind of words we cannot interpret in the patient record. We have to use common vocabulary where everybody can understand. And next one is whatever you are writing, documenting, it should be legible. It should be legible means seen by anyone even after 10 years. If any person comes for the claiming of the patient details, you should have that legal evidence. Legibility, clarity should be there, clearness should be there in writing the words. And whatever we are using abbreviations and the symbols, it should be universally accepted. It should be universally accepted. The best example is doctors usually write in the case notes RX in the name of treatment, and some people may use the nurses diagnosis symbol as like triangular with SIS. So this is all universally accepted symbols and abbreviations. So those kind of abbreviations we can use, but the present current scenarios, what kind of abbreviations we are using in other apps and all, we cannot implement in the documentation process. And content should be organized manner. That's why if you go to the medical department, they will tie all the bundles of January month, February month, then like this different. And even when it is come with a legal, medical legal cases, those records will be in a separate bundle and it is secured well. And when you are writing even the case sheet also, it is organized. One side vital signs, another side treatment, and the corner they will write the investigations. The presentation of the documentation also should be in a systematic and organized manner. And next one is accuracy. Whatever you are documenting, make sure that it is correct. Make sure that it should be in a correct one only. Accuracy. So most of the time, who will notice it? No problem. We can write it whatever. But in case if the patient has some other legal problems, then some police people may come for inquiry about the case sheet, and we need to have proper accuracy, otherwise you will be put into the trouble. Okay, then documentation should have a checking of medication error. It has some color coding, is morning in the blue color and night red color. These kind of things we need to check errors correctly, and we need to document properly. And other thing is, when you document any content, it should be confidential. It should be confidential. This matter, why I am saying is, sometimes some patients may explain their personal information also for documentation. Like, did you expose to any sexually active with other partners? When you want to know about sexually transmitted diseases, or when you want to find out HIV, gonorrhea, syphilis, sometimes some partners may express their personal views or the personal feelings with us. So when you document anything, that should be confidential. Usually what we will do, yeah, that bed number patient is having this one and bed, so those kind of things should be avoided. And next one is, it should be a factual one. It should be a factual one, legally evident. Legally evident. When you write or when you document or when you fill anything, that should be a factual. Yes, you have not given injection, not given the tablet, but you have written, that will become a false information. So it should be a factual. And whatever documentation you are doing, it should be complete. It should be complete. Half and half if you are giving, and if you transfer to other hospital or you shifted to other place also, people may call for the verification. Because when you have kept a document with incomplete written half, he is experiencing so and so, and continuation, what is that matter, is having a heart problem or is having a cancer or is having any other communicable problems, you need to mention very clearly. Let's say call it as completeness. And whatever you are following, that should follow in the current strategies, that should be followed in current strategies. And next one is, it should be organized properly, already which I mentioned, organized properly, systematically, legibility, proper completeness, clearness, universally accepted abbreviations only need to be included, and it should be accurate. It should be accurate, and it should be relevant and legibility, and you have to check for errors or anything is there, and this documentation should be a confidential one. So I hope I gave you a very very important question. These need to be explained one by one, then you will get a 5 marks question. That is all about elements of effective documentation, elements or principles of effective documentation. So I hope I'll continue with the next sessions. Thank you for watching. If you really like my class, please do subscribe. Thank you.